using our football field for graduation Saturday morning.
Oh, nice.
So, have efficient spacing that way. And 10 a.m. the dew may be off and it won't be too hot. Yeah, you know,
Got a narrow
get
window.
Saturday.
Saturday may be too hot. Steve Troyer.
Steve Troyer,
Yeah.
okay. And your assistant. Okay, thank you for intro purposes. All right, well, it's 10:30. Welcome, everyone. We'll get started today. I'd like to, of course, welcome Dr. Remington from the Kosciuszko County Health Department and Dr. Tom Edgington, Superintendent at Wawasee, and his assistant, Steve Troyer. Welcome.
Thank you.
We'll get to you all here in a bit. Obviously, we'll start off with our big news in the last week, and that's that county-wide testing began yesterday. It was a very quick situation. We were notified about midday Monday that they would be coming, and I asked when, and they said tomorrow. So all good. I said, great, come, we'll find you a spot. And I think we're pretty happy with the way the first day went. We're down in the west parking lot of Central Park. We tested 177 people yesterday, and I would say that was a pretty full day for them. We've got interpreters down there, which is helpful. Again, the testing is free. This was set up by the Indiana State Department of Health. They came into our area, and they will be here for 2 weeks. They started yesterday, Tuesday, and will go through Saturday. And then again next week, same schedule, Tuesday through Saturday. So that testing, let's see, just to get the dates to make sure we're all, that was the 14th through the 19th, and then the 14th through the 18th, and then the 21st through the 25th. So 2 weeks, 9 a.m. through 6 p.m. Not much is required other than you're asked to stay patient, remain in your car. Again, the testing is free. They'll ask for a phone number or an email so that they can contact you with the results. I spoke with their lead from the Department of Health this morning and asked him if there's anything that he wanted me to get across, and he just said, you know, it's hot down there. They're working hard. Just, again, be patient. A few times I was down there yesterday, there was about 8 to 10 cars in the queue, sometimes in double lines, so I think folks are certainly taking advantage of it, and 177 is a pretty significant number of tests in the first day. Let's see. So the second item is that certainly the free testing is also continuing in the county, supported by the CARES Act money at all 3 MedStat locations. I know Warsaw is 7 days a week, and they run a little bit wider period, so folks have to work. That's another option. Again, that's free. It's encouraged to get online and make an appointment if you can, and fill out all your paperwork that's necessary. There is a rapid testing option, but it is not free. I want to reiterate that it's not free, but there is a rapid testing option at Physicians Urgent Care. So again, between those, excuse me, those three options, I think we've got a pretty significant amount of testing right now in the county. Dr. Remington and I were talking yesterday, and I'm sure these gentlemen from Wawasee Schools will acknowledge that once school starts, testing will probably become even more important. So the idea here is that we try and utilize this testing, take advantage of it, and hopefully try and keep the state testing site here if we can. So we'll just, again, see how this goes. We're feeding them lunch, trying to make them feel a little more welcome, but it's hot down there, and I know they're working hard. There's a couple members of the Indiana National Guard that are helping out with the testing, and then I think the other 4 employees are from State Department of Health, and then we have a young translator from Grace College who's down there as well. So it's a good group. getting our testing results back is I know, one of the challenges of testing in a timely way. You know, it's typically 5 days, as I would just call that an average if it's going out to a lab. The state testing site has told me that their results may be coming back a little quicker. They're calling it 3 to 5 days. MedStat, I know we're being told 5 to 7 days, and then of course there's the test that doesn't require a lab, which allows for immediate results. But I was on a call this week and had heard that some of the labs are now doing analysis of tests from Arizona and Texas because of them being overrun with testing and with their cases. So I think our results are getting delayed a little bit because of the volume of analysis that has to be done at these labs. And again, it's just a sign of what's going on. Again, as I mentioned, I think it's critically important that we continue to do everything we can to keep the testing in an accessible fashion, and hopefully with as rapid results as we can get. But I know that's going to be the challenge that none of us have any control over, and I know Dr. Remington can talk a little bit about that as well. I would continue to ask everyone to wear masks in indoor and outdoor public spaces, that you're unable to socially distance. You know, we can't say it enough. It's the one thing we can do. And while, again, there's no mandate here in our county, I think as the numbers ramp up, this becomes even a more critical conversation. So I did want to mention that there's a blood drive. There was a blood drive yesterday and today, as well as next Tuesday. You can get on the Red Cross website and sign up. I know there's critical shortages of blood. We had a very busy day in the park yesterday with COVID testing and blood drives. And again, that continues. The importance of both of those, again, can't be overstated. But again, the blood drives, and then I believe there's another blood drive later this month. There's a group from the high school that's doing some of the volunteer work, and we'll get more information out about that. With that, I will turn over to Dr. Remington. We had a nice chat this week, ramping up for the testing that occurred, and I want to thank him for his assistance. I know the health department has been instrumental in getting the testing here, and we just found them a site, and now they're here, and it didn't take long to get it going. So, Dr. Remington?
Thanks, Mayor, and thank you for being so engaged with this topic, really helping us, and providing a quick space for the State Department of Health. We had very little heads up on this, and we appreciate the State Department of Health coming. Our case count continues to grow, I'd say at a steady rate. Over the last 6 or 8 weeks, we are averaging less than 100 new cases per week. We've not seen explosive growth, which I'm most thankful for, but yet our cases aren't going to zero. There was a very small growth in numbers actually for the last 7 days, and I would hope that continues, but we'll hold our breath on that until we see the results of expansion of testing that is unfolding before us with the State Department of Health drive-through testing. It's a very efficient way to get a lot of tests to the community, very low barrier, and we'll see what they find. Having said that, then I'm not seeing metrics, at least in my opinion, that drive us to mandate masks in this county, nor to take an independent step backward from the governor's opening up Indiana plan. Those remain on the table. We can do those if we feel the need. I personally do not feel our numbers are pushing us to do that at this time. Masks are very important. Please wear them in public settings where you cannot socially separate. Most commercial settings you step into, retail businesses, please wear a mask. It's a gracious thing to do for the people working in that store. avoid congregated settings indoors as best as you can. Think twice, particularly if you are ill or frail or elderly, before attending a large outdoor event. I would say frequent hand washing, all those things that we've been saying for months now. Please don't let down your guard. The health department remains very involved in a supportive role in this community. Just lots and lots of phone calls filling our day, whether it be our communicable disease nurse, Teresa Reed, and her staff, or whether it be our administrative staff, Mr. Bob Weaver at the courthouse here. Just lots of phone calls supporting businesses, individuals, schools, trying to make decisions. Mr. Weaver and his staff are deploying more PPE that's been requested to different healthcare providers in the community. The state continues to send us up large volumes of masks and N95 and gowns, gloves, that kind of thing that we dispense as we get them. That's a large part of our day. Testing needs to expand if we continue to say the things that we're saying in public health regarding opening up, that it hinges on testing. There is no prevailing public health voice that is speaking contrary to that. So tests are important. And I think it's increasingly quickly recognized this will really come to play when we open schools here in a few weeks. The first Johnny or Susie who shows up in the nurse's office with a fever of 101 and a cough will be sent home with direction to seek care and get a test, and strong recommendation that if there's growing concern that is a COVID case, that all the household contacts be quickly tested. So this is a dynamic discussion, and it's not just in Kosciuszko County. This is a national discussion. We need more POC testing, point of care tests with quick turnaround, and there has to be buy-in in the public health community as to what those tests mean and how we use them. But if we're going to avoid long queues and community angst growing because Johnny or Susie just can't get to a test or the result isn't coming for 10 days, the only way we're going to get around this is to get to different platforms of testing. And I am lobbying for that personally with the State Department of Health for some buy-in on the antigen test platforms that are available. Physicians Urgent Care here in the community has a molecular assay on a POC platform, which is very helpful. Those test positives are recognized by the state of Indiana as true positives, and thus we fold in case investigation contact tracing, which we feel is why we test it anyways. Case investigation contact tracing with schools opening up is another hot topic. How's this going to look? And I think this will fall heavily to us as a local health department, and my conversation with Mr. Weaver this morning was along these lines. How are we going to do this? How can we staff up for this? We'll need to be in advisory capacity very strongly with the school nurses and administration, and hopefully good coaches to help them build quickly with all of us the right matrix of seeing these kids who are sick and how do we think through them. Our philosophy as far as school closing, should they ever come down the road, will be to be as surgically precise as we can be around sick Johnny or Susie. Rather than closing down the whole school, we're going to try to dice this out. Who was the cohort or the classmates around Johnny or Susie? Who rode the bus within a bench or two from them? And we're going to try to use best practices as they emerge, I might say, through this whole discussion, and apply it locally, case by case. We will all have a growing combined experience and growth of understanding how this plays out quickly in the weeks ahead. We are all for these schools getting back to operation. Kudos to them for each of them figuring out how this is going to look for each of their jurisdictions and their constituency. We're in a very supportive role for them, in no way antagonistic, in no way pointing fingers that this could have been done better, or rather this was done incorrectly and How could you? That will not be our posture. There will be learned lessons for all. And we think it's a very good thing that kids get back to school. That's all I have.
All right.
Thank you.
Well, that's a great segue into our guests here. And Dr. Remington, you know, you make a great point. Health Department certainly has their role to provide the assistance, the access to testing, contact tracing, understand the numbers, interpret them, and how they can assist our community with hopefully getting to the point where we can recover, getting the schools together. You know, obviously, local elected officials have their roles to try and acquire and seek access to every asset possible in this pandemic battle. And I know the school corporations have a responsibility to families and children and their staffs to try and get things going. I listened to Dr. Cadup talk about Grace College's return this morning, and I know last week Dr. Hoffert and his staff came in, and I know have been spending a lot of time getting to the point where they're going to make this move here soon. And we certainly welcome you down today to talk about Wawasee School Corporation and what this all looks like for you. So, Dr. Edgington.
Thank you. Thank you, Mayor. Thank you, Dr. Remington, for being here today. And we appreciate that the community comes together at a time when there is a great need, and there is a great need, and it's good to feel that we're all in this together and not separate school systems or not separate government agencies, that we're all working together. To do that is to benefit our students. Our student enrollment at Wawasee is about 3,000, which is little less than half at Warsaw, and we are in 5 schools, our high school of close to 1,000, and then 4 schools of about 500 students. So each community, Milford, North Webster, and Syracuse with an elementary school, Milford with a component that is middle school, and a separate middle school on Highway 13 that is really our only school visible from a state highway, and then our high school in Syracuse. So we are certainly a busy community this time of year as our population doubles in size with people visiting the various lakes, and it just takes longer to turn out onto the street and such. So there are interlopers in our midst here for 3 months or more. Just to let you know, we are during the summer working to meet student needs while students aren't directly in our schools. We're feeding hundreds of students, distribute meals twice a week, and about 9,000 meals a week totally. So are working under federal guidelines for that have been loosened, fortunately. The old rules were that you had to watch the students or children as they ate to make sure that the recipients were those intended recipients, and now that can be a pickup service given our current situation. To let you know, our high school is having summer school. I think, Dr. Troy, you're over 100.
Yeah, we actually had 2 sessions, so 110 approximately at the beginning of June, and then another almost 60 continued into a second session.
And those are online classes using a computer program, Apex. High school athletics opened July 6th in the state, and those are conditioning type practices. That we have certain protocols in place to make sure that the students are appropriately separated, but it is a time when students are together, and I'm sure breathing more heavily than normal. That's part of the conditioning part. Our elementary, our K through 8 summer school begins on July 20th, and we asked that Dr. Remington and others looked over our plan. We are bringing in students on buses. Some are dropped off by parents, and to do that, we are wearing masks on buses and into the buildings and doing checks, and students are wearing those masks until they are in the classroom and being instructed, and then it is an option, though recommended. So we have close to 200 for our summer school.
Little over 150 between our elementary program, middle school program, and then we have a kindergarten jump start program that's a piece of that as well. Also partnering with United Way of Kosciuszko County for their Start United program in our summer school program as well, so we're appreciative of that.
We do jump in then with our school and students on August 13th, and we're still planning for that date to begin school. Our school board last night approved our plan that we had outlined for them, and they had a chance to go over that along with any visitors at our board meeting, ask questions, and move forward. And Dr. Troyer, you've been instrumental in this plan, if you'd like to hit those highlights.
Yeah, so I can just present a couple of the specifics, if I could, talking about our plan at Wawasee. Looking at models of instruction, we have basically 3 different models. We've got a face-to-face model, which would involve students in buildings. We have there's numerous hybrid possibilities that would involve some face-to-face and some level of digital instruction. And then certainly we would have a distance learning model that would not involve coming into the buildings. In particular, having an online virtual school, which I'll talk about here a little bit more, will be an important part of our plan moving forward for our families that aren't ready to send their children back into school. That will be an option for us as we move forward. So to kind of frame our discussion, we established 4 district response levels that we could put our district in that would kind of dictate what model or models we're working in. A district status with a level 0 would be completely normal operations, and certainly we're not looking at being at level 0 in the immediate future, but hopeful that at some point we can get back to that.
That would be great. Yes.
Yeah. So level 3 on the other end of that would be some type of a stay-at-home order issued from the governor, from local agencies that would dictate us to be in a completely remote environment, such as what we were last spring. And then we have 2 levels in between, level 1 and level 2. And I would say that they're probably aligned heavily with the stages that the state is on for the Back on Track Indiana plan. So level 1 would indicate that we would be at stage 5 and have some of those restrictions lifted a little bit. And level 2 would be anything less than stage 5. And so I think we're hoping to find out something this week as to where we're going to be at for our beginning of summer school program next Monday. But certainly we would be hopeful that by August 13th we would be in level 1, which would then allow us to carry forward with the plan that we put and that we put together and presented at the school board last night. The main difference, I would say, between a level 1 and level 2 would be enhanced safety protocols that we would be looking at, in particular with masks and with distancing guidelines and recommendations that we would be asking our folks to abide by. So we're planning to be in level 1 at Wawasee by August 13th, and certainly that's what we're hoping for, but we'll make adjustments as needed. So to say that, then we put together really 2 documents that we took to our board last night. The first was a guide for on-campus learning, so that would be for those families and children that would choose to send children to school for in-person, face-to-face learning. And we are planning on that happening in each of our 5 buildings beginning August 13th. We are planning on 5 days per week with some minor tweaks to our daily schedules, but nothing that would be significantly altering for a school day, and I'll talk about that a little bit as we go. So looking at some health and safety protocols, we've developed an at-home screening protocol that we're going to ask families to kind of work through. We're not going to at this point be collecting that data. That becomes a really overwhelming project if we're collecting the screening data for 2,500 to 3,000 students every day of a 180-day school year. But rather, what our vision for the screening protocol is that we would put that into the hands of every family and ask them and educate them to be really intentional about examining the health of their children and what they potentially could have been exposed to prior to sending kids into facilities. So the screening protocol essentially would look at exposure to COVID-19 and then some symptoms, specifically fever greater than 100, cough, shortness of breath, chills, muscle pain, sore throat, loss of taste or smell, and nausea, vomiting, and diarrhea. Any of those symptoms and or exposure, we would ask that parents not send children into buildings and that they would seek a health provider's opinion before making that determination to send. And so that will be kind of the first step in trying to keep our buildings safe and healthy and really avoid the spread as we've been talking about. Looking at certainly some enhanced sanitization, cleaning protocols, hand washing opportunities, really being intentional about keeping our buildings clean and sanitary. Those kinds of things are outlined in this document. We will be adjusting our custodial teams to make sure that high traffic areas and high points of contact and classrooms, common areas, etc., are focused on not only throughout the day but also then in the evenings and on weekends. In particular, then also with our school breaks that are built into our calendar. Focusing on some deep cleaning procedures that would be a part of our plan moving forward. Regarding masks and face coverings, I would say that we are going to be very similarly aligned to what Warsaw schools are doing. We are going to recommend that students wear a mask, just a blanket recommendation. Students and staff for that matter, but we will allow them to remove masks in classrooms once they're in and set, and for some of those whole group instruction times, they would be able to take that off. We are strongly encouraging that students wear a mask in hallways, restrooms, and other common areas. And then at this point, again, operating in level 1, making that assumption that we would only require a mask on school buses and in health clinics, and potentially where spaces would be very limited, where we would have a lot of kids and or staff close together. We will be providing masks to all our students and staff, cloth masks. So we are planning to provide 2 masks at this point to every child and staff member. In addition to, I think we've got some masks, Dr. Eddington, coming from the state Department of Ed. So that would be potentially another 1 to 2 masks that we would be able to provide. So those will be provided. We also have a large number of the surgical masks, the disposable variety that we'll have on hand at all of our facilities, all the buses, any point of contact where people would be coming in, that if people don't have a mask and they wish to have one, that we could get them one. So that's in our planning and thinking. We also outlined some necessary quarantining measures that we would ask for children that would be that would have a positive test or that would have symptoms, that they would be out for a certain period of time. So those are some of the health and safety protocols that are indicative of our in-building, on-campus learning. Some changes that we would be looking at for our schools and classrooms. One of the big changes that we have that we recommended to our board, and ultimately that our board adopted last evening, was a change in school start time. So we have a 1 day a week at Wawasee. We have what we call a smart start. It's a late arrival time. So if school would typically start at 8:15, then on a smart start day it would start at 8:45. And so we made a recommendation that we would start school a half an hour later each day rather than just that smart start day. And that's really designed a couple reasons. We could have, or we plan to have, targeted cleaning and allocating our custodial resources in each building during that time. So that's just an extra half an hour built into the day that we don't have kids in building. But then also in looking at how do we support our teaching staff in working with kids who are inevitably going to be out of the building and working in a digital environment for some period of time, and making sure that we give staff time to really work in a high quality way with those kids. And so when we've looked at this, we really have 3 groups of students. We have the first group is going to be kids that are in building doing on-campus learning, and they're showing up every day. We have a second group on the other end that is going to elect to do online only learning, and they for the most part wouldn't ever be in a building. And in our plan and our thinking, they would be served by some dedicated staff that would be designated just kind of online only teachers and staff that are working with them. But then we have this really complex group of students that are going to be in building, and they're potentially going to have to be out of building for a certain period of time. Maybe it's 10 to 14 days while they quarantine or while they recover from an illness, etc. And they're coming back into the building, and that's the group that we're particularly concerned about with how do we manage their learning during the time that they're out. As we talked with our leadership teams and our Teachers Association, we really felt that that group of kids would be best served by those classroom teachers that they were a part of in building. So rather than they go out for 2 weeks and we put them in a kind of disconnected digital learning environment, we want those kids to continue to progress along with the rest of their class. And if that was our feeling, then we had to find some time that we could support teachers with in working with those kids. And so that was our thinking, in particular with the late arrival time, that would give us some time, that would give teachers some time to really support that group of kids. Maybe it's 5 to 10 kids at any given moment that are out of their classroom that they need to have time to work with and really pour into them. And so in our thinking, that half an hour gives us that opportunity. The other piece to that is that it really gives our central office, our building principals, people that work with instruction, an opportunity to provide some really targeted professional development related to digital learning. I think we all feel like we did as good a job as we could in the spring with the moment's notice transition from in-building learning to all online learning. And as we move forward with that, one of our priorities is to continue to grow and get better at that digital instruction piece. And so this will give us some time to provide some professional development that we feel really good about. So that's the school start time. Our individual buildings will be communicating start and end times to families, but pretty much people can think about that as that smart start time every day rather than just on Wednesdays. So that would be a big change for us. And did want to point out that, and I told the board this last night, the moment that we're able to kind of go back to quote unquote normal, then that would come off and we would just do our traditional one smart start day a week. Also wanted to point out with our school start times that the Indiana Department of Education released guidance on what constitutes an instructional day. And that guidance was 5 hours at the elementary level and 6 hours at the secondary level. And so the later arrival would still allow us to maintain compliance with the instructional time that we're asked to gain from the Department of Ed. We will be restricting visitors into the building. Certainly they'll be able to come in and into the office area, but probably not into classrooms and hallways and different spaces. We're not looking at doing field trips and big group convocations, trying to keep our groups smaller. And then public events and programs that happen in schools that are a really big, important part of schools and the communities that they work within. We'll have to evaluate that on a case-by-case basis, but it's very possible that some of our big community programs and events that we would normally have in a school year may either have to look different or not happen altogether. So those will be looked at on a case-by-case basis. And then whenever possible, we'll encourage outdoor learning, and PE will certainly be taking advantage of weather when the weather's nice and being outside and those kinds of things. So that is our on-campus information, and then I'll just talk a minute about online only option for student learning. Like I said earlier, we do realize that there are going to be families, and we've heard from families already that are worried about sending children back into schools, and so we want to provide them an opportunity to participate in an online program through Wawasee and managed by Wawasee teachers and staff. At the elementary level, we're really looking at kind of cohorting students into grade level groups, and they be managed by a grade level teacher. So essentially running an online class of first graders that are working together, and they have a first grade teacher. And so that would be a big part of our elementary program, and designating grade level staff for the management of that. And those would be Wawasee teachers that would be a big part of that. At the secondary level, we have some other options. It becomes really complex at the secondary level because one teacher doesn't necessarily service a group of 20 kids. It would be 6 or 7 or 8 teachers that would service that same group of 20 kids. And so to dedicate one teacher in that capacity would start to really be complicated. And each of those teachers at the secondary level, it's not a generalized teaching license, they're all content specific. And so we're going to be taking advantage of some online learning platforms that we work with. In particular, Apex Learning has some high quality digital curriculum programs in place. And where that may not work, we'll also be using Indiana Online, which is a kind of a similar digital class, and we'll have Wawasee staff that will help then coordinate a student schedule in those different programs. We will also be assigning students that work in the online option a remote learning support team that would consist of teachers, counselors, a learning coach that would help support students as they progress in the digital environment. So one of the things that we've discovered that happens or that can happen is when students work in an online only environment, which we have some of those happening on a case-by-case basis anyway, but that it's easy for them to get lost in the shuffle because they're not coming in and checking in and working with our staff in building every day. And we feel strongly that we need to get a team together that really is intentional about checking in on not only academic progress, but also social and emotional needs for those kids that aren't coming into our buildings. And so part of that, a big part of that will be the remote learning support team that we put in place at our secondary levels. At the elementary level, that will be handled by the classroom teacher that kids are working with. So we have an enrollment form that we will be asking families to enroll in if they're interested in the Wawasee virtual school. And that will be posted on our website here later today. That would be my intention. Having just received board approval on this last night and then coming down here this morning, that is not up immediately, but hopefully later today. So there will be an enrollment form. We are asking families that if they choose that they would commit to at least a trimester. And part of the thinking is that we've got to have time to align staff resources to run those programs. And so we need some time to put that together and perhaps reshuffle some classes that we were potentially looking at. The other piece to the virtual school option is we are setting a target date of July 31st, which is 2 weeks from this coming Friday, to make a commitment to that so that we can put that in place and get things sorted out, because very shortly after that we'll be starting school. So That's the online option. Dr. Eddington, I think I covered most of it.
Did a great job.
Yeah, thanks.
Thank you, Dr. Troyer.
Yeah.
Just to let you know, and that folks would know, we had no idea that this virus would hit, and yet we had planned and are carrying out some construction work at our middle school and high school to make our restrooms, half of the restrooms in the high school and all those in the middle school, the no-touch type restrooms. So we must have known something, because you can go in and use those, and they're more automatic and don't have to touch things. That just worked out that way, and hope that all that work is done or about done when school begins. The federal government has CARES Act money and distributed that. Our share of the money we are using to help dedicate some people to just dealing with effects of the virus over the next period of time. PPE that we are buying in bulk, and other safety measures, and also testing for employees and such. So we are making good use of those funds that are at our disposal for this unique situation. You know, when we went to school, the teacher would say, don't look at your neighbor's paper, you know, you do your own work, and spelling test, you aren't looking over at the neighbor's paper. And that still holds true today, that students would do their own work, but as school districts, we are looking at one another's papers, and what we see what Warsaw is doing and talk with them, and Tippecanoe Valley and Whitco and other neighbors, and we didn't learn to do that in school, but it is the right thing to do now, to cooperate with one another, and we're doing that freely, and will through this coming year in the term for getting done with things. As fate would have it, I think our graduations for Whitco, Tippecanoe Valley, Warsaw, and Wawasee are all this weekend, and that may have been just fate that way. But ours is 10 o'clock on Saturday morning, and we have limited seating and such, a ticket-only event, and it's unique times, and everything is different. It's different in medical world these last several months, and different for you after being a role model for how to catch and deal with something, and people look up to you as the example. So how to deal with things. So we appreciate the opportunity to
Sure.
come today, cooperate, communicate, and that Dr. Remington would take time from his busy schedule to be a part of our time together, and you for hosting.
Yes, thank you. I certainly didn't ask to be a role model, but unfortunately that happened, and you know, it's part of the lesson. You know, you let your guard down a little, and that virus can get in. So, and I would also comment, I think we're all kind of looking at each other's papers on this, because there really aren't any right answers. It's what works best for the community. So thank you for sharing, and certainly we'll get to a few questions here. I did have just one or two comments I wanted to make. I did want to thank the Northern Indiana Hispanic Health Coalition, their assistants. Liliana Quintero is up in Elkhart with her hands full up there, and she certainly was a big part of trying to get more testing here, and has been a real great influence on our community, again, trying to stay ahead of things so that hopefully we don't end up with the problems that our neighbors have to the north. So thank you to Liliana and the Northern Indiana Hispanic Health Coalition. As I was sitting here listening to Wawassee's plans to reopen, came across on the phone that Walmart, as of Monday, will be requiring masks in their stores. So that's just playing into now two major retailers in our community with Menards. Certainly, I'm happy to see that. And I'm going to take the lead on questions because I'm going to give Dr. Remington a softball. We talked about it earlier, but there seems to be a lot of discussion, I think, on social media about are there certain blood types that are more susceptible or more resistant to the coronavirus? And I had many people ask me that in a very short period of time, so I assumed there was something going around on social media. So we're going to go to live media with Dr. Remington. I asked him to research that, and he already had his understanding of that. So, Dr. Remington?
I appreciate the heads up, though. This is an interesting facet. Certain blood types, just on an observational basis, seem to weather COVID infections better and have less of them. O blood type. A's not as well. What you do with that, can't do much. You're given the blood type that you have. You don't lower your guard if you're an O, and you don't retreat further if you're an A. But an interesting facet, it is observational. There's a little biology behind it, apparently, with some of the genetics of blood types. So stay tuned. It's very preliminary. This, I believe, was culled from a lot of pre-published data, which has been a part of the conversation with COVID. So it hasn't been perfectly vetted in a peer review perspective, but very interesting. Certain facets of this discussion have had those elements of fascination, but just hold on a bit on that one.
All right. Well, I'll be looking on your paper when you make that answer to that question. And I did get a question from our live streaming about bus transportation. How will you handle that? Will kids be able to transfer to different buses? How will they socially distance on your bus routes? I know that's a big part of the return as well.
It's tough to social distance on a bus, and so we do something we were doing already was to separate middle school and high school students on buses. They were spending more time on the bus, being picked up at the high school, driven 5 miles, picked up at the middle school, and then the route run. And the same thing happening in the morning with dropping off at high school and then middle school. Just more time on the bus. We separated those routes, so the middle school has exclusive routes and high school exclusive routes. But we expect that there will be more than one student to a seat on most buses, and we aren't certain how many parents may choose to have the opportunity to drop off their students. More and more parent drop-offs have been happening the past decade anyway, and less students riding the bus. So
Okay.
just that way, the students will wear a mask on the bus. There
Right.
will be hand sanitizer available, and as they get on the bus, and the mask will stay on. Those bus seats are higher than when we were kids, and of course it was a bar in front of us, a metal bar when we were kids that went up and over the seat. But everything is padded, well padded, and people are in their own little cubicle on the bus. So we will. That is our plan for busing.
Okay.
And mask required.
All right. All right, gentlemen. Mr. Spalding, go ahead. You raise your hand first in true classroom fashion.
This is directed to our Wawasee guests. I just want to make sure, will start time be 8:45 or?
That's just an example, so one of our buildings, maybe a couple of our buildings start at 8:15, and then, as an example, it would start at 8:45. But that would be potentially by building. So the high school doesn't start at normally 8:15. They start at a different time.
They're at 8:03, so it would be 8:30-ish, yeah, approximately.
But all schools are pushing back their start time 30
Yeah.
minutes.
Yes.
Yeah.
All-
Will you add on 30 minutes at the end of the day, or not, are you?
No.
Right, and we will be more efficient with that time during the day with lunch and such, so.
Also, do you have any target expectations for the number of parents who will opt to have their children stay at home?
We did survey, we surveyed parents, we surveyed our staffs, our teaching staff, just with questions, and we estimate that initially 10% in that range may choose to have their students at home for that first trimester. So that would be 300-ish children out of that. So with the opportunity then in November to join in if they would feel more comfortable.
So if things, if circumstances worsen, you've got some cases and parents get nervous, will they be able to opt into this distance learning in the middle of a trimester? Or if that's the right term?
That'll be something that we have to take a look at. We've kind of asked, going the other way from in-building to online only, them to make a commitment, because we have to put together how we're gonna staff and serve those kids. I don't know that we've discussed too much the possibility.
We were so optimistic.
Yeah.
We just knew things would be getting better as we go, that things hadn't really crossed our minds. So.
I think there would be an opportunity to do that, and you know, certainly if we have a significant portion of our population that would come to us and say, we really feel like we need to get into this mode versus this, that we would make some adjustments. It's just gonna have to, things would potentially have to be shuffled and rearranged from a staffing perspective to be able to make that happen.
Right. Okay, thank you.
Yeah.
Nick, your hand was up next.
So, Warsaw talked about extracurricular activities last week. With your reopening plan, are you guys also taking a similar approach where with sports or any clubs that they have to be there in person, or are you gonna allow those that might be in the hybrid with the in-person and partial e-learning to also participate?
If they are totally at home and part of at-home learning due to the virus, they would not be coming in for clubs or athletic led athletic activities at this time. So if the purpose would be to have their children separated, so that's that would be our plan would then, I guess, be similar to Warsaw.
Would that also be the same with the hybrid option if you had staying at home sometimes and then coming in person sometimes?
If they were in the school for part of a day for some reason, then that would be the same as being in school. Yeah. So we want children to be, avail themselves of things, but in a manner which we know is safe.
And just to be clear, at this point, there isn't an election for a hybrid option.
Okay.
That would be a decision that we as a corporation would make that would put us into a hybrid option instead of an only in-building option. So what that would look like, as I said earlier, there's numerous models for what different people are doing, but I guess you could consider somebody that was in a class and out quarantining and back in a class maybe being hybrid, but there wouldn't be an opportunity for somebody to select, I want to be hybrid at this time.
All right, Mr. Sloan?
We're talking a lot about kids not coming back to school, but declined to come back, retire early, whatever, because they're afraid for their health or our loved ones' health. So have you heard any concerns about teachers and staff going back? And do you have enough teachers and staff in the school year?
Our principals have surveyed their staffs, talked with individuals who have concerns. Some of those are indeed health-related, and we will be taking those into account. And some of those may have been health concerns even without the virus, you know, due to health situations. So we would do those on a case-by-case basis. We would expect that teachers, if they did not have health concerns, that they would be there and teaching teaching our kids. So I haven't heard of otherwise that way.
All right.
Sorry. Dr. Remington, so when classes get back into class and you've got some children who appear to be sick, and if this grows, I believe you mentioned that county health department would do the tracing or contact tracing, the research. And you're going to do this for several schools. I guess my first question is, do you have the staff to do that? And also, if testing is contact tracing research starts to fall behind and you don't have enough testing, and then there's this lag in getting test results back, could all of that be reason maybe to revert back to distance learning for an entire school district?
We're going to try real hard to avoid that. I think this will be a challenging time. We will take a motif of teaching others to help us think through this very quickly. And that advisory capacity with the school nurses, school administration, it's going to take a village on this one. If we too strong-handedly try to be a centralized repository of all case investigation, contact tracing, you're right, it'll fall flat. There's no way we could do that. So it all depends on that volume, and we don't know that. True to the course of this pandemic, we just have not known the next curve in the road. But we're ready, and we'll take it on and work with school nurses strongly and try to foster a growth of their comfort level in working through these with us. That'll be a strong motif. The state contractor is not in the discussions very quickly with this whole thing with schools, as per the discussions and readings that I have been involved in the last 10 days or so. So maybe they'll be able to ramp that up and be nimble and integrative with our schools quickly, but I see it mostly as the health department working with schools. And families. Families got to help us out with this. The triaging that you mentioned before the child ever comes to school, of such importance. That growing list of symptoms attributable to COVID is vague. And I'll just say, as a clinician in the trenches, 6 weeks into any school system, any school year, here it comes. Even in non-COVID years and way ahead of influenza experience, about mid-October, late September, you're feeling that the community's engaging with schools again, you know. So all those kids are gonna still do that. Those are not all COVID cases. We're gonna have to sort this out.
Also, I believe you certainly have a hand in preparing the county health department's annual budget. Are you looking at an increase for next year, maybe more staffing? Or?
So it's interesting, the motif I think will be of some contractual influences to local health departments across the state. We too, I mean, the income stream has taken a hit with COVID from the tax base, so we'll have to work with that. there are some CARES Act funds out there that we may learn to tip into more than we have thus far. We've had gracious team players at the city and the county, of course, with those CARES Act funds, so I don't sense it'll be problematic. We've got enough nimble staffing at the health department, we can rob from Peter to pay Paul kind of thing. And that's how we'll be approaching this.
And just to mention the CARES Act money, you know, the state was the recipient of that money and distributed it to local units. And the state so far has been very specific that these dollars go directly to COVID-related expenses. So there's no revenue replacement. There's nothing as far as recovery. This is strictly COVID-related expenses. So I'd like to think that there's a reasonable amount of funds that we have been made available to us that we will continue to utilize to, again, try and get us to the point where we can start to look towards recovery a little bit more in a little bit clearer view. So,
You had asked about tracking a particular student, and we would hope that, and it's tougher as the students get older, as in high school, but that a student would sit on the bus in the same seat every day, you know, with the same students around them, so that when the health department says who are the ones in that region on the bus, what the bus driver knows and we know, and they would sit at a particular seat in the classroom and not just choose seats every day, eat lunch with the same or around the same people, and just try and keep those groups as tight as possible. And that isn't the way schools normally are, and the you know, your free choice, you know, is going, but that really would help the health department if they should get word that something needs checked that way.
So just to be clear, is your school district mandating or requiring assigned seats for school buses, classrooms, and lunch?
Yeah,
Okay.
yes, and more so at elementary than middle, and tighter that way. And high school is still working through like lunch. We have 2 lunch periods now, and they're looking at 3 just to be able to have better separation and such. So, and things that August 13th look like it was a ways away until now it's less than a month. So,
Right.
yeah, the perspective changes.
so getting a little past our time, but certainly if there's any pressing questions,
I
yeah,
just have one
sure.
question. During the school year, it's kind of typical for families to move in and out of the school district. If a new family moves into Wawasee, will you make them self-quarantine for 14 days before they start the school year, or will there be special procedures? You know?
That is a good question. I'm looking across the room and like, yeah, we haven't discussed that. And we do have new students who start out the school year. People move over the summer, but
I would not push for that. I think the logistics push against the real value of that. There is some value in that, but how are you going to pull that off? So I would not, just quickly here, my first thought would be not to overly push that.
yeah. But if the child's, if they're registering the child and they say, I can't smell anything, I can't taste anything, and their temperature, no, anyway, so.
If they exhibit symptoms, obviously,
Yeah.
there would be a need to do that, as with any student you would
Yeah.
have. So, well, I think we'll, again, unless there's any other questions, I think we'll draw this to a close. Again, thank you to Assistant Superintendent Troyer and Dr. Edgington, Superintendent from Wawasee. I know questions will be generated from today's press conference. I am looking at maybe a little bit closer to the start of school kind of coming back and having a kind of a Q&A for maybe Dr. Hoffert and you all, and we'll kind of try and put that together, because I know this is continuing to evolve. To that end, you know, I feel like with schools starting and the numbers being a little uncertain locally, definitely ramping up nationally, these mask orders changing, I think there's probably enough to continue having these weekly press conferences at least through middle, late August, once school gets started. I think there's a lot of information in this. We've had very, really great viewership and hits on these press conferences, both streaming. I know the radio's put some of them on, and there's a lot of people looking to what we discuss here weekly to help, excuse me, guide us through all this. So I think for the time being, at least through the beginning of school, we'll continue these weekly. So thanks again for coming down, spending the time. As always, Dr. Remington, appreciate you coming, and I will tip you off to any hard questions next week.
Always appreciate it.
So, all right, thank you very much. Appreciate it. Thank you.
Of course, I'm type A on the blood.
Oh. You're doomed.
Yeah.